Meg Terrell joins us right now with a special guest ahead of the conference kickoff. Meg, good morning.
Good morning, Becky. That's Stefan Bancel, the CEO of Moderna. Stefan, thanks for being with us this morning, kicking off our JP Morgan coverage. You know, just hearing from Eunice there, the whole world, of course, caught up in Omicron right now. What can you tell us about what the world looks like from where you sit, about whether we're going to need to update the vaccines to Omicron, what the future of our next potential dose looks like, when we might be getting that? What does it look like from where you sit?
Are going to be around, $17.5 billion. They, of course, have to be fully audited in the coming weeks.
And so do you expect that at some point this year, the decision will be made to have to update the vaccines? At what point will we know how frequently we're going to need another dose? What does the future look like, as much as you can tell?
Sure. So again, with biology and this virus, we all want to be very humble. As you know, we're working very actively on an Omicron-specific vaccine as a booster. That should be in the clinic very soon. And we are discussing with public health leaders around the world to decide what do we think is the best strategy for a potential booster for the fall of 2022. We believe it will contain Omicron mRNAs, but do we need to add any other components? That has to be discussed, because we need to be careful to try to stay ahead of a virus and not behind the virus. What is interesting, Meg, is if you look at governments around the world who are very much looking into 2022, on an earnings call on November 4th, we said that our signed APAs were $17 billion, that we had options for up to $3 billion. And we're reporting this morning at JP Morgan that we are increasing those expectations because countries have been placing a lot of orders. Our signed APAs with upfront payments are now for $18.5 billion. Recently, the UK, Switzerland, South Korea have ordered for the fall of 22. And now the options have been increased from $3 billion back in November to $3.5 billion. And there are discussions ongoing on a daily basis with a lot of countries who want to be ready with the best product possible for the fall of 22. And as you know, the real-world evidence data has really shown very strongly, and you see it in all the OECD countries where it's really, mRNA vaccines being used, that the Moderna vaccine show very strong duration of efficacy, and that's really important to protect people.
So these orders are for the fall of 2022 and can be essentially whatever vaccine construct is deemed most appropriate at that time, but essentially talking about boosting almost like we do seasonally with flu shots, it sounds like. Meanwhile, the World Health Organization has set a goal of vaccinating 70% of the world by July, and that's unfortunately a pushed back goal from when they had set, to do it last year. Do you think it's realistic that we can reach that goal by this summer? And is there more that Moderna could do to contribute to that?
So I think there's two sides of getting the world vaccinated quickly. One is the supply of vaccine, and the other one is the ability to get the doses in arms in those countries. If you look at the supply of vaccine, it is true that for around 2/3 to 3/4 of 2021, I would say around September, October, the world was supply constrained on vaccine. There is no doubt. But the world has totally switched toward the end of the year. I shared that in November, we had any given day of the week between 50 and 100 million doses waiting to be shipped to low-income countries. And there's been a lot of issues on the distribution and deployment of those vaccines. And I've heard from my colleagues in other vaccine companies the same thing. We even shared this morning that we've heard last week from the African Union that the 60 million doses that we had reserved for them for Q2 this year, they decided to decline them. And the reason for that is between the COVAX orders, the donations from Europe, the donations from China, the donations from the US government. They have way more vaccine that they need to get to the 70% vaccination rate in those countries. And so they informed us that they did not want the 60 million doses of Moderna vaccine for Q2.
Hey, Stefan, just a quick question on following up on that. You mentioned that you have contracts that are ready to go with South Korea, the United Kingdom, and Switzerland, I believe, for vaccines to be ready for the fall of this year. Where do things stand with the United States? Are you in negotiations with them? And what's the situation just in terms of how much you can supply come this fall? Will there be shortages, or will every country that wants them be able to get them at that point?
That's a great question, Becky. So let me start with supply first. We're in a very different situation that we were last year. Last year we were ramping up the supply chain, building the manufacturing capabilities. And if you look at the output that we had in Q4 with 300 million doses, that was our highest quarter ever. As a reminder, in Q1, we supplied 100 million doses. And we have a lot of new capacity coming online in Q1 of this year. And so we think we can supply 2 to 3 billion doses of boosters this year. And if you look at the numbers I mentioned, the 18.5 billion of already signed orders for 2022 and the $3.5 billion of options, they are mostly front-loaded in the first half of the year. There's still a lot of capacity available for the fall. And as I said, there was a lot of discussions ongoing, including with the US government.
And Stefan, where do things stand with the vaccine for kids from Moderna? With Pfizer's getting delayed to some extent by a few months, there is a gap in coverage in the U.S. for kids under 5. Moderna, of course, is still waiting for clearance for under 18, and you need data for kids in that middle age group. But I wonder, because there is that gap in coverage, where do your data stand in terms of the timing of getting that? And could Moderna potentially help fill that gap if your results are different from Pfizer's and you get them earlier?
Yes, so indeed, Meg, for teenagers, we have a vaccine approved in most countries but the US. We should get very soon data in the younger children that do not have access to the vaccine today. We are, of course, in literally discussions with the FDA several times per week. The agency is very up to date to the data and the timing of the data. As soon as we have the data, of course, we'll share it. And we are, as always, hopeful that we can help do our part and help protect as many people as we can.
Hey, Stefan, I have 2 questions. One relates to targeting Omicron in terms of the next booster. There seems to be some debate in the scientific community about whether if you do that, you effectively create or up the odds, if you will, that we actually get a new variant on top of it rather than dealing with the initial. I have to admit I don't understand the science as well as I should. The initial approach to this with Alpha. Can you speak to that? Sure.
So I think, again, with biology, we all want to be humble. We don't know what we don't know. But the way I think about it, Andrew, is number one, as we see, unfortunately, many people are being infected as we speak. That is a great opportunity for the virus to mutate, given literally, I think, several billions of people we're going to get infected with symptoms or without symptoms with Omicron. What we have learned over the last year with the vaccines available to the public and with real-world evidence is that if you have very high neutralizing antibodies, you can prevent infection from person to person. And that's a bit the trick that's happening with Omicron now, is because there's been such a huge genetic shift from the original virus to Omicron that actually the protection against infection person to person is actually not as good as it was with the previous variants. And so we personally believe at Moderna that doing the next generation booster containing the Omicron sequence is going to be important, not only to educate the immune system to those new mutations, but especially to protect infection between different people.
wasn't sure if Andrew had a second question there, Stefan, but I'll take it here. You know, we are asking you so much about your vaccine, obviously, because we're in the thick of it right now, and it's still going to be important, obviously, for a long time to come. But you're working on other things. You announced a deal this morning in oncology. I think a lot of questions from investors at the conference this week for you is going to be about your valuation and what you've got beyond the COVID vaccine. So what should we see from Moderna this year? What should we expect in terms of seeing a lot of those other mRNA-focused projects coming to fruition?
Sure. So as you know, Meg, mRNA is a platform. mRNA is an information molecule. And so we have now 40 programs that are in development and actually many more in the labs. And the thing that excites me is first around the respiratory disease. There are around 10 viruses that get humans into hospitals every year. Flu, of course, is very well known, but RSV and many other viruses that are not very well known to the public because the symptoms are similar to flu. Well, we believe the world deserves a single annual booster that contains all those different vaccines in a single dose against flu, against RSV, against COVID, with the right adaptation to the strain circulating that year. And that's what we're working towards. We have an RSV program in phase 2/3, we have a flu program in phase 2/3, and we want very quickly to combine this. The other piece we are doing is we are partnering with governments around the world to build manufacturing facilities in their countries so we can customize the vaccines to the strain circulating in the country. We've announced so far, a 10-year agreement with Canada, where we're building a plant in Canada for respiratory vaccines adaptation to the Canadian strain. We just announced recently the same 10-year partnership with Australia. Basically, they've agreed and committed to pre-purchase respiratory vaccines. So that's, I think, is going to be a very good mononucleosis and birth defects caused to CMV. But the long-term impact of those viruses that basically drain and weaken your immune system has huge implication, we believe, on cancer. Right. And we're working actively on that because there's no CMV or EBV vaccine on the market. And then this year is going to be exciting because we're going to get data in the clinic in oncology, in rare genetic disease, and in autoimmune disease. So a very exciting year ahead.
Stefan, two final quick questions. One is, given how quickly, unfortunately, it appears that the boosters and the vaccine diminish over time, I know we're talking about the fall. There are a lot of people who've taken this in September, in October, in November, if not earlier than that. And that means that they would be going effectively 6 months without. And so are you advising people, or would you advise people to try to get it earlier? So if somebody took it in, I don't know, September, October, I think I took mine in November, but you'd be pushed out effectively to May or maybe June, as opposed to waiting until, say, September, October, November of this year.
Yes, Andrew. So I think those are really important decisions for public health months, and I'm sure public health experts will make the right decision to protect people.
All right, Stefan, we really appreciate you being with us this morning to help us kick off our JP Morgan conference coverage. Thanks so much. We'll listen to your presentation later, and we'll check in with you again soon, we hope. Thanks again.
Thank you.
And Meg, thank you. Coming up a little later in the show, Meg's going to bring us another special guest from the JP Morgan conference. That is Pfizer CEO Albert Bourla. Squawk Box will be right back.